Right, so you can begin.
So kindly introduce yourself.
So I'm Sister Catherine Joan Kawira. I'm a nurse by profession. I've done KRC 10 and higher diploma in medical education. And I'm a religious sister. I'm the principal of Consolata, Global Nursing School currently. Yeah.
Thank you. So, Sister, kindly tell us a bit of a background about the nursing school.
So this nursing school was started back in 1958 by the Consolata missionaries. We started by training, or they started by training enrolled nursing. That was in 1958, and around 1978, Kenya registered Kenya enrolled community health nursing. Back in 2002, around September, then we started training the diploma course, the KRC 10, or Kenya Registered Community Health Nurses. And that is what we are training currently. It's the only course that our students take here.
Okay.
Yeah, and we have 2 intakes. That is currently we have been taking in March and September. We used to call them March class and September class, but currently with the changes in the Nursing Council of Kenya from this year, we have still 2 intakes, but they have changed a bit. So there will be one in April and another one in October. And also the changes have occurred in the Nursing Council exams. Before we were taking in January and August, but from this year we'll start from August and April, and that is how the program will continue as far as we know, or as far as we have the information from the Nursing Council of Kenya.
Thank you very much. There seems to be a very rich history about the school from the 1950s.
Sure.
So kindly tell us how the learning takes place here. What is the learning environment, how learning is done in the institution?
So what happens in our institution, as I said, we train the KRC agents and the intakes. So in the course of training, we have 6 blocks. And like other places or other colleges that have maybe semester or whatever, but we are training in blocks. In block 1, they come in class for 4 months. Then after that, because we have to combine after the classroom work, or what we call theoretical learning, we take them to the practical areas. So after the 4 months, we take them to the clinical areas for their practice. Then after some times, they come for block 1, 2, 3, 4, and 5. The 6th block is supposed to be the preparation for the college exams that qualifies a student to do the Nursing Council exams. So after every block, they have some months to cover in the practical areas. As you can see, our master rotation there, it shows the years, the months that are supposed to be covered for each president. Like we have community health. If you can see, community health takes a lot of time. That is around, that is community health nursing, 28 weeks. Then obstetric takes around 36 weeks in the training. So after every block, they go to the ward or other special experiences, because we have also other special experiences outside our hospital. Like psychiatry, they do it in Meru, sometimes in Meru, and also Embu. And they have also community health experiences. Currently, we are sending them to Meru Health Center and also Roili. So all this must balance, because what the students do in class, they must see these things in practice, and also they must practice so that they become competent nurses. Otherwise, the field will be full of quacks. So in our institution, we look forward to training quality nurses, and in fact, in the market, our nurses, I think, not to be proud, but our nurses also, we hear a lot of compliments, and before we release them, they are really calling, people are calling, when are they qualifying, how do we get this? So that is how we do our training. And also, our team is very, very much cooperative. So we have the tutors who are here, institution, and others who come for locum, so that we find that we give our students what they need. So that is how we do our training. And in the course of the training, they also have assessments as they have exams in the class or in theory. We also have other assessments in the clinical area for their practice, and also to make sure that whatever they are doing, they are really getting the correct thing, or they are giving the correct treatment for the patient. Also, they have some case studies that they write. We have medical surgical case study they write too, midwifery, and also community health, and we have research also to write. So all these must go together, so that at least we are sure whatever we have given them, they can also be able to produce in future. Because we don't train them just to remain diploma nurses. We train them to go even higher. And we are proud even when we find them in the other bigger places, and we tell them, we want to find you higher even than us. So that is our pride, that our students also in the areas of discipline, they are gone quite far. They are gone quite far. And that is where we are working hard that in future, we are sure that they pass well, and not only passing in the training, but also in their performance as they go in the field. So that is how our training looks like, or the overview of our training.
Yeah, this seems to be a very rich experience in class and hands-on experience in the field and in the clinical areas. So if I may ask you a question related to information access. So how do they access additional information or resource materials when they want?
What we have a library. Currently, it is not there. We are installing the internet purposely for learning, not for other issues. So currently, we have some computers which are being fixed. And thank God you have come at the right time, because you will be very rich. We are going to enrich our programs there. The library is there. We also encourage them to use their mobile phones. Those who can afford, they have their laptops, and that is how we try to connect them even to the world. Yeah, so they have their mobiles, we encourage them. We have also our library, and we are connecting that internet for better learning. And then we are sourcing, like you are bringing to us materials. That's why I'm saying we are going to be very rich indeed. And thank God you have come the right time. We are very proud of you. Yes, and not only you as individuals, we are very proud of Amref. And we hope that we are going to continue supporting each other. It's a good experience, if I may say.
Yeah.
And so exciting also to our students and staff. And particularly our students, because they need all this. They are really missing some things that are very good and very rich. Yeah, and that will help us also to encourage to do more and to learn and to come out successful. Yeah.
Thank you. You sort of answered also my last question. So the last thing I want us to do is to appreciate, already you've appreciated Amref. And I want us also to appreciate the donors who have also made a contribution to the project. I want to scribble down the name of the donor so that you can be able to see it. It's a bit complicated.
Okay, that's fine.
So that you can appreciate them as well.
Don't worry, I'll make sure I edit that bit.
It's
point out.
Yeah. Otherwise that video would look awkward. So now these days we call ourselves Amref South Africa. The others when you see.
What is postcode?
This is Dutch postcode lottery, and then this is Amref South Africa, and the rest is just partners. So you can just say you want to appreciate the donors who are the Dutch postcode lottery, Amref South Africa, and the partners for the project. The project is called Nkubu. Nkubu, yes. So you thank the Dutch Postcode Lottery for supporting the Nkubu project financially, and then you thank Amref and partners for having maybe developed the solution, involved you and your students in the use of the solution. That's it. Yeah, I hope you can be able to see.
So I want to appreciate so much all those people that have been so good to us, especially our donors, the Dutch Postcode Lottery, in collaboration with Nkubu Project and Amref. This is a step that we have been hoping for a long time, and this has come to us. So thank you very much. When you go there, tell also the partners that are doing the same work with you that we are very happy, and we want you to continue supporting us and other Kenyans, and indeed the whole world, because things are changing from time to time, and we want this, and we want to change with the world. So we appreciate and we are very happy. God bless you and keep you well.